So, with that said, I would actually like to start with our panel, and I will call them up to the front of the room. And excuse me because I have to take glasses on and off these days. First, I'd like to welcome Dr. Katja Noyes, who has agreed to moderate for us today. Dr. Noyes serves as professor in the Department of Epidemiology and Environmental Health at UB. And she's also the director. She wears many hats on campus. She's the director of the Division of Health Services Policy and Practice. She also holds a leadership role in our CTSI and is the Associate Dean for Translational Team Science within her school. She joined UB in 2016 after a distinguished career at U of R, where she focused on bridging public health and surgical outcomes research. She also has significant knowledge and scholarly work in the aging space and caregiving space. So thank you, Katja. Mary, I think I'll grab the mic from you and we'll hand it over. A bunch of our colleagues who have expertise in this area were kind enough to agree to participate in this first panel today. So next I'd like to call Dr. Hinchey to the front of the room. She is within the School of UB's Dental Medicine and is Assistant Dean for Clinical Affairs and Director of Radiology. Her career path has included hospital dentistry and academia, ultimately leading her to a fulfilling role in oral and maxillofacial radiology. She's also passionate about teaching and mentoring. We also have Dr. Waller from the School of Pharmacy and Pharmaceutical Sciences. I saw Bob earlier. Oh, there he is. Okay. Bob is actually, he's also one of the leadership team of Team Alice that Mary was explaining to us this morning. He's a clinical associate professor in the School of Pharmacy, and he's involved in geriatrics, palliative care, and has served in clinical pharmacy leadership roles, including at Niagara Hospice, and is an associate faculty member also here on the Jacobs School. We also have Dr. Abigail Green, who joins us from the UB Department of Psychiatry. Dr. Green earned her medical degree. Actually, she's a UB alum in 2015, and she completed her psychiatry residency at the University of Pittsburgh Medical Center. Since joining UB in 2019, she has distinguished herself as an educator. Among her honors are the Outstanding Contributions to Medical Student Education Award and the Lewis and Ruth Siegel Award for Excellence in Teaching. She also specializes in geriatric psychiatry. Thank you for joining us, Abby. And lastly, we were generously connected with the UB Office of Human Resources, and we have two colleagues that are joining us from here today. Michelle's joining us. Michelle Poitras is our first panelist from UBHR, and she's a leader within the University at Buffalo's Wellness and Work-Life Balance Office. She oversees initiatives that enhance employee engagement and success, and she champions a holistic approach to well-being. It's just absolutely amazing that she has this role on campus, and we're so fortunate to have her. But through her guidance, she fosters a positive and inclusive workplace culture, supporting balanced growth and fulfillment for all UB team members. So here is our panel. Katja, you have a lapel mic, correct? I mentioned to the panelists, we do have to share the handheld, sorry, but if you just turn them on, they are working. So thank you, Dr. Noyes, for leading.
Let's make sure folks can hear me.
You don't need the handheld.
Yeah, I'm going to pass it on. Can you hear me in the audience? Okay.
Yeah.
Can the folks on Zoom hear me? So thank you very much, everybody, for joining us this morning. We have prepared a set of questions for our panel today. And then, Dr. Sissig, will we have time to take questions from the audience afterwards? Yes. Fantastic. So I will start with asking Dr. Hinchey a question. Can you please explain how poor oral health can contribute to worsen chronic disease in such as diabetes, cardiovascular, or dementias and Alzheimer's?
Hi, good morning. Thank you so much for having me, and happy to be here to talk about such an important talk, if you will. So it's pretty incredible how there's a huge link between oral health and systemic health. If we look at something like diabetes, it's bidirectional. So if you have periodontal disease, which approximately 40% of adults over the age of 40 have some sort of gum disease, it actually can, that chronic sort of inflammation can actually, really ramp up the diabetic sort of condition, and vice versa. An uncontrolled diabetic will see this ramp up of gum disease. So it's pretty incredible to keep your oral health, pretty pristine in order for your overall health to really, maintain itself. In terms of cardiovascular disease, it comes right back to that gum disease, where if we have that chronic inflammation, it really puts us at higher risk for developing cardiovascular conditions. The Alzheimer dementia sort of route, this is sort of new in terms of the links between oral health and Alzheimer's. I was just reading a recent research that they found neuroinflammatory or neuroinflammation was linked to certain oral bacteria. So it's pretty incredible when you really think about that the mouth really truly is the portal into overall health. So keep brushing, floss the ones you want to keep. And
Thank you very much, Dr. Hinchey. I want to introduce another speaker in our panel today, Dr. Cordero Weiss, who is a PhD and a nurse-trained investigator in the School of Nursing. So, Dr. Weiss, a question for you. So, for you, having both experience as a nurse, a researcher, and caregiver, how is your professional training shapes the way you navigate the emotional and physical demands of caring for multiple generations like we hear today?
Thanks for having me. Thanks for having me. My training as a geriatric nurse helped me understand the physical and social connections importance for the transitions of care as caring for an aging person, and also helped me to have a different take on the compassion that is necessary to be a family caregiver. So we learn so often about the importance of advocating for the patients, advocating for family members, understand the healthcare transitions, understand the language that's being taught to them for what the care management plan is. So as a geriatric nurse, I could make the bridge between my family and the healthcare team, but also, as I said, have that resilience and build compassion for being a family caregiver, also navigating having a full-time job and taking care of younger people.
Thank you very much. Yes, we heard about advocacy, and that's not probably the skill set that we instantly think about when it comes to caregiving. So, Dr. Waller, I want to ask you on another specific skill set. So, as a member of, say, Sandwich Generations, as you heard about, often have to manage medications for their loved one and for their family. So, what should caregiver and providers know about medication management before family sort of assumes that responsibility?
Yeah, thank you. And I think kind of picking up on what Mary was talking about from the kind of the intergenerational, if we think about medication management is not a skill that we learn in school. It's not passed down. It's often a personal thing. We take our own medications. So the skill of managing those medications is very hard to pass on. And we often make caregivers, I like to call them care partners because there's a bidirectional meaning in care partners. We try to make them nurses overnight, and Carlera will tell us that that doesn't occur. They don't have the experience or the knowledge behind that. And I think one of the things that, especially on the provider side, is the amount of burden that is put on a care partner overall, but specific to medications, research, I looked it up like Mary looks things up. The burdens that have been associated with medications include unfamiliarity with that kind of, and we've all kind of experienced it, not only unfamiliarity with medication, but even unfamiliarity at the practice level, because many practices almost have a revolving door these days. Ambiguity about the medication regimen, especially when things aren't well explained. And, this is where kind of health literacy and assessing patients for health literacy is, will they even be able to follow this medication regimen? Fragmentation of care, if we think especially about our seniors, but also about kids. They go from consult to consult, especially if a kid, has certain diseases, they're going to be seeing multiple providers as well. And that fragmentation creates such a burden on the parent, in that case, providing care through medication. Exclusion is another burden that was identified in that when care partners aren't recognized for both their experience and what they provide to their care recipient. And then concealment, and I don't mean this in a negative way. It's not that we're, well, in maybe some cases it is that we're purposely withholding information, but it's more that it's preventing that they need. It prevents them understanding, personalizing, and using what they want and need to know. And I think I point these burdens out because they're factors that we should, when working with the patient. I'm a pharmacist, I talk about, how to use their medication, but trying to understand the ringer sometimes that patients and their care partners go throughout the health system, and they come to the pharmacy and their head is just spinning sometimes. So trying to understand if we realize what causes some of these burdens, and we can try to overcome them.
To the extent we can, and we're going to talk about legal issues and privacy later on today. Thank you. Yes, you can pass it on to Dr. Green. Dr. Green, you're a geriatric challenges that both caregiver and patients will be struggling with. Could you please talk about that, what we should be prepared to face and recognize?
Yes, thank you. And thank you for having me to talk about the mental health aspects of the sandwich generation here. I think both the caregivers and the older adults and children all can face their own unique mental health challenges. When I think about, the older adults themselves, many of them are struggling with the idea of loss. And when I think about that, it means not only loss of maybe relationships, a spouse, siblings, friends, also loss of maybe independence or activities that they used to be able to do for themselves that are no longer able to, maybe loss of their health status. And so that loss really can increase the risk for through any types of neurocognitive changes, even in mild stages, also can increase that risk for mood disorders and depression feelings. When I think about caregivers, really these caregivers are being pulled in many directions, often feeling stretched very thin emotionally, physically, financially, and often leave them with a sense of guilt that they should be doing more, that they're not living up to their own expectations. This can lead to feelings like burnout, resentment, difficulty sleeping, also placing them at increased risk for things like depression, and often comes at the sacrifice of their own health, not taking the time to see their own doctors or mental health professionals to address some of these concerns.
Thank you very much. Michelle, thank you for being here. So we talk about all of these very personal issues that we do at home, but we also come to work. So what can you recommend or advise people who are working professionals? What kind of support and services do we have for the challenges that they're facing as a caregivers?
Thank you. Um, Perfect that I was after you because a lot of sentiments we have. I facilitate a powerful tools for caregivers class. And while I do that for the University at Buffalo, it's a wonderful program that's offered free. I'm going to share the resource to find that. But if you are a caregiver, I can't tell you how helpful it is for our participants in the group. They offer them in Zoom, they offer them in person. But a lot of the things that we talk about are, what you were saying, people are overloaded. They're not experts in these areas. They feel a little lost. There is that guilt. There's overwhelm. And I mean, I meet with people who they haven't made their own doctor's appointments, but here they are caring for their children, caring for their parents or another family member. And we're just finding that people are just stressed out and they put themselves last. So that's one of the things that people have to work on. People are not using their support services. Another resource that I'm going to share with Jill is there's a respite program through New York State Caregiver and Respite Services. It offers up to $600 in grant money essentially for you to get that support so you can get caregiving. I know somebody in our powerful tools used it for respite care while they went on vacation because they needed that vacation to get away and they knew that their loved one was being cared for. And the other thing that people I don't think are prepared for is that shift in roles. If you're caring for your parent used to be your caregiver and now you're their caregiver. And that is something that I don't think people take the time to really think about and to just digest and realize, wow, now I'm caring for them. So that's something that really people need to take the time to think about. And unfortunately, we see that as our generations are going on, our health problems seem to be increasing. So we're seeing a lot of people are having their own healthcare issues while, again, trying to take care of young children, taking care of other people. So these are all things that we have to think about.
Thank you very much. It's great that state recognizes those challenges and provides some support, but most of the time people don't know about support that's available to them. So I want to ask our panelists, are there any other strategies that you would advise or recommend both to caregivers for self-management and prioritizing their health to be more functional and able to take care of their patients, and perhaps recognizing that they have their own needs and making educated decisions, want to focus on your needs before taking care of the needs of your family? Anybody?
I can start speaking on that. What we see often working as a geriatric nurse, working in the research in the geriatric population, is that the family caregiver put themselves last on the list of what they need to do to take care of. So I would really recommend don't skip your own health appointments. Try to have at least 10 minutes a day that you have time to yourself, to evaluate yourself, check yourself for, do you need to do some physical activity? How is your diet doing? Are you taking your own medications? Are you taking time to reorganize and recenter for the next day? It feels that people who are in the Sandwich Generation, they take care of sending off the kids to school, make sure that they are getting ready, going to their work full-time or part-time, come back, take care of the grandparents, their parents, and then go to sleep without taking time to themselves, and keeps on that cycle that builds up the burden for both physically, mentally, and emotionally. So I often talk to people in the community, and that's the sentiment that I get from them. And there is a lot of shame that they put on themselves and guilty of taking time to taking care of themselves. It's almost like they don't deserve that time because there's so much going on with the people that they love and care for. But it is important to take the time. And I always say at least 10 minutes a day to start taking care of yourself and making sure that you are healthy enough and stable enough to provide for the ones that you care. And also Don't be afraid of asking for help. Can be a partner, a community, your neighbor, somebody that is in your family that you can find as a reliable person. But don't be afraid of asking for help.
Thank you very much, Dr. Weiss. Sort of normalizing the caregiving process and not feeling that the whole world is on your shoulders. That's very important, and I know it from my own research that women caregivers especially tend to do that, putting themselves last and develop problems. Thank you. Dr. Hinchey, any specific services that the School of Dental Medicine provides? I know you have a dental clinic, something that can help people navigating multiple appointments, preventive care in the dental space.
Sure. My motto is an ounce of prevention is worth a pound of cure. When you really kind of look at the cost of dental care, preventative dentistry is far less expensive than when you need to have, that root canal that might cost you nowadays is probably up to $2,000,
An implant.
or an implant that can cost you up to 10. Whereas you come in for a cleaning and an exam, and we're talking maybe about $200. So it's certainly prevention is the key to good oral health and therefore good systemic health. The dental school is a great resource. We offer student-run clinics, and then we also have our postgraduate clinics. So these are doctors who are coming back for extra training. We have an AEGD, which is Advanced Education in General Dentistry. So these are the guys that are going to become the next general dentists who are the superstars of dentistry. They can do pretty much everything. And then, on our student-run side, it's D3 and D4 students who are providing the care. However, they're doing it under the very close supervision of specialists. So if you say bring in a parent for a denture, it's not, it's a specialist who's making that denture with the student. It's a great sort of resource in the Buffalo area. Within the next year or so, we're trying to increase our intake of special care, what we call a special care population, which would include, patients who have Alzheimer's or dementia. Currently, we're working in a smaller kind of pilot clinic, if you will, mostly with patients who have IDDs or intellectual developmental disabilities. But dementia and Alzheimer's patients, they do need that extra kind of level of care, if you will. So it's again another great resource that we're hoping to really be able to bring in more and more patients over the next few years, and then of course for the little guys, the kiddos, our pediatric dentistry clinic is where the more the merrier kind of thing. So if you have children, you give us a call. If you just look up UB Dental Pediatrics, we'll get you in pretty quickly. The new chair of the department is a wonderful Dr. Brett Chiquette, and the rest of the team have been there for ages, and it's a great happy environment. It's a lot of energy, and for me as a radiologist who usually sits in a dark room, it's very intense, but it's a great sort of area. So come on down. We're happy to see you, and grab a toothbrush.
Thank you. So I heard about family medicine. I haven't heard about family dentistry. That sounds like a new way to do it. So Bob, since we're in the medical school and I think our main audience are providers, so what should providers know and be able to advise caregivers about managing medications at home? Because obviously we never have enough people to do meds conciliation at home for every single family.
Yeah, I think there's a couple things. One quote that I pulled from an article was, clinicians should not assume caregivers are actively and consistently involved, especially when you're meeting with, patient and their, typically daughter, their adult daughter. Don't assume that and initiate that conversation. ask how are those medications, or how are you interacting with those medications? Don't make that assumption. I think the other part is that we need to look at there is no one size fits all when it comes to medication management. Needs are different across the board. But what we should try to do is first and foremost have that updated list of medications. I know we all kind of harp on that, but that is a number one. You have to be working from the most accurate list of medications, and then there's a number of available tools for care recipients, and the most important then is once you have that list, develop a system, whether that's a pen and paper, whether that's online tools, and there's a number of different online tools you can actually fill in your list, and then it prints out almost a medication administration record. Those tools are available, but we don't necessarily tell care partners about those. Obviously, filling a pill box. My mom, passed away last year, and since I was the pharmacist in the family, I was the one called on to fill the pill box. And it was actually out of that I had insight into my mother's medication taking, because then I found when I would go back the following week, not everything was taken and things were in the wrong place. So she had, maybe moved things around, maybe spilled it. We don't know sometimes. So that is a tool to use as well. And then many pharmacies and even Amazon are providing the pill pouch. I think there are downsides to that, but that can simplify things as well. And I am going to tout one of Team Alice's programs that we just received funding for from Health Foundation of Western and Central New York. We've developed what we call our medication safety and empowerment curriculum, and that's intended for both patients and their care partners to not only learn more about medication safety, but also empowerment, how to talk to your doctor about this, how to bring questions about your medications up. We're rolling this out initially in a pilot project in a number of senior centers in Erie and Niagara County. Our goal is to be able to roll this out to all the senior centers in Western New York. Much more comfortable, and if we think about all those interactions that we have, is there, and I think Mary sometimes mentions this about Alice, that she would never have said a thing to her physician from the contrary, questioning. It's like, you didn't wash your hands when you came in the exam. She would never say anything like that. And I think a lot of the older generation are like that. So we need to give them the empowerment that, yes, you can ask questions about your medications. You should ask questions. Part of what we do is also work on the provider side to make sure that is a very then open conversation.
Thank you very much, and congrats on your funding. I look forward to more interesting work. Dr. Green, so the benefit and two-sided sort of reinforcement of the relationship, but a lot of times people start declining and not diagnosed. So what are the signs and symptoms that the caregiver should be looking for to distinguish the signs of normal aging from early symptoms of neurodegenerative diseases or medication complications?
Yeah, that's a very good question. I think we all can recognize that with normal aging, there can be occasional forgetfulness or misplacing things. The key distinguishing feature is that those abnormalities are not interfering with the person's ability to maintain independent functioning or continue to do those IADLs and ADLs on their own. Now, if we see that there are some impairments in that independent functioning, we want to start looking at what could be causing that. You mentioned things like medication side effects, absolutely. So correlating if there's a change in the person's mental state related to any new or recent medication changes, that's extremely common and often undetected. Could it be, it may be related to something like depression, which is very common in that population and can lead to what we've described at times as pseudo dementia. So looking like the person may be losing their memory, but really the underlying cause is a depressive disorder. And in these cases, someone, to help distinguish, I would look for other features. Is there a loss of pleasure or joy that the person seems to be experiencing? Are they just no longer doing things that they used to enjoy, even if it was spending time with the family? Maybe they have started refusing food for no real clear reason. So some of these factors would want to raise our suspicion, and going to see your provider, especially in the primary care setting, can do some screening tools, depression screenings, as well as cognitive screenings that can help us distinguish what might be going on. Often the depressed older person puts very poor effort when you're trying to ask them memory questions, and they just respond, I don't really know. I don't know the answer. I'm not sure. That's a clue that I look for, that this person may be having a mood disorder rather than an actual, cognitive impairment or cognitive disorder. So I think communicating with your primary care provider is going to be your greatest resource for these concerns and can help guide you if further specialists need to be involved, or can do basic screening for these different possibilities right at the office.
Thank you. We have questions? Okay.
Oh, no.
We should open it. So let's see if we have any questions in the audience on Zoom. I'll go, Jill.
I don't know if this is.
May not.
Oh, okay. I just want to see if you can point out things that care partners can do to navigate the switch of independence, where elderly person used to be really independent and now they think they can be, but they do not. And what we can do as care partners to navigate that properly and respectfully, and not get in the turmoil of all the things that one needs to do. And this is another decision that you need to make quick, leaving the elderly powerless.
Thank you. Would want to take that?
I'll just start. I think one of the things that's important is communication. I think just sitting down and having that difficult conversation. And I think that that's one of the things that I find with people in the powerful tools. They push aside that conversation because they don't want to have it. So sometimes it's just, and if you tell them why you're concerned, if it's not of a, it's about caring.
Control.
Yes.
It's
It's not about control. It's about safety. It's about your concern. And even with other siblings and things, sometimes it's like my brother lives in Myrtle Beach. I live here. My mom shares her time. And I said, hey, there's a couple of things with mom I want you to watch while she's with you. So that look out for it. So just, I think communication is a piece to include.
Thank you.
And I think from the medication side, some of the research shows that most care partners value the independence of whoever they're caring for, whether it's an older generation or younger generation. And, you know, obviously the little kids you have to be more proactive with, but it's also a kind of a teaching moment, how to manage medication and with that younger generation. But I think the important part in what we've seen in older individuals' medication is allowing them to be independent, similar to what I was saying before, until safety is seriously compromised. And that is, you know, that's kind of that maybe instead of, you know, unfortunately having to flip the switch quickly, but to get involved earlier and just say, Mom, can I see your medication list? Can I, you know, help you just see, I want to learn how you fill your medication pill box, you know, to start there and then be able to monitor that, because when that does become a serious issue, they're not taking their medication or they start having side effects or anything like that, then you're much more clued in. So I would, kind of work that slowly, I guess.
Thank you. Anybody else?
I think about this is particularly related to safety issues. We're talking about medications. I think another common one is driving. And these are conversations that I have frequently. So if I don't think it's a terrible idea to rely on a neutral party, whether it's the person's doctor or a friend or somebody, rather than the direct caregiver that maybe raises these concerns. Trying to involve your older family member in the concern and considering some problem solving strategies. So, you know, I think with driving, maybe offering, let's go, ECMC, for example, has a driving program where they can help assess the person rather than saying, no, you can't drive. Let's go to this driving program, see how you do. Sometimes, you know, people have certain, they want to feel that they have some role in the decision making. Maybe it's even just knowing that their car is in the garage, but they don't have the keys and they don't really intend to drive, but that it's there and that doesn't pose any particular safety risk to anyone. You know, coming to some conclusion together that can satisfy both parties, and then rely on a neutral party like a physician in this case if you need to. That's no problem. We commonly have these conversations.
Thank you. Dr. Weiss?
I was going to add something similar about respecting and integrating the family member in the decision making. I think that's it's an important role for dignity, right? We care ourselves for our lives, taking care of ourselves, taking care of our family. Now the role is switched, but the person needs to understand that they're not being disrespected or disregarded in that process. So respect their dignity, including them as much as possible in the decision making. And as a family caregiver, you're probably gonna notice the days that they are more aware or less aware of what's happening before they make that hard transition between mild cognitive impairments to dementia, for example. So taking opportunity on those moments to have the conversations that are important and use that as a guide as you progress through the disease, and making sure that they always feel respected in the decisions that are being made with them and not for them. Right? That's what I would include as a geriatric nurse.
That's a fantastic comment. Very important to keep in mind. Any other questions from the audience or on Zoom? The question. No, I can do it.
Hi, I have a question.
So I appreciate the feedback from the panel, but what if you have someone, a parent that you are a caregiver for that does not listen, that does not work with you, that is just has their own mindset, and you want to respect that, but at what point are you legally either obligated or empowered to make a decision for that individual who is not being safe? That's my question.
Thank you. I know we have a whole session on legal aspects of caregiving later on. So perhaps it will come up in the discussion. Thank you.
Uh-huh.
Was there another question? On Zoom, they cannot
They
hear.
can't hear you on Zoom, sorry.
And as we know, we're talking about elders, first, second, and third generation. Conversation for me and emotionally for me is large families with multiple seniors, but brings the next generation in because that's what you do. But then the next generation or that generation is dealing with children with severe or multiply different kinds of disabilities. When siblings don't work together, families fall apart. The question for me is, what I haven't heard is the conversation on that specifics. Yes, it'd be great that, you know, the parents are taking care of the grandparents and the kids are happy-go-lucky, but that doesn't happen. For me and for others like myself, we're dealing with aging seniors, just like what this beautiful woman said, that parents just don't want to do it. You have to respect that, but you have to make those decisions, but you also have to deal with your children or those young children who have multiple different kinds of disabilities. That's a lot. So as that panel, as you dental, psychiatry, human resource, and pharmaceutical, and even nursing, what can you give me an answer pertaining to that?
Thank you.
I think one of the things that people don't do, I think Dr. Weiss said it earlier, but I think the thing is that people think they have to be everything to everyone. So I recommend making a list of the things you're willing to offload. So if there are responsibilities that you have that you'd say, you know, it's okay, maybe I could ask someone to help drive my kids to something, or maybe I can ask this parent to help me, and figure out who your people are. Because I know you mentioned siblings aren't always there, and that's something that we're finding is that I think some siblings, when their parents get sick, they retreat because that's a protective mechanism for who aren't always there. And I think we apply intention because we assume that we know what's going on with them. But sometimes when you realize, God, there's a lot more there than just being selfish. There might just be a little bit of a protection. But then saying, hey, what can you do? This is my list. How can you help me? And think outside the box. I have a family outside my family who are just checking in on me. Think about those people who've said to you, how can I help? How are you doing? And reach out to them and see what you can do to get help and utilize services. I think I've learned about things that I didn't know that ECMC had a driver assessment program. So for me in Powerful Tools, that's something that I'm going to recommend to people. But I think that's the problem is we don't always know what programs are out there. So I think the things that I'm learning today have been so helpful. I wish there was a one-stop shop for too.
I can also just add quickly, some of the panelists that are going to be here this afternoon from some community organizations have some really great programs. So I think that they can offer some insights as well.